Hello everyone. Now we are discussing the heart chief complaints. We will discuss two things, the chest pain and palpitation. Those are the most common ones. So we should always remember our basics, which is the OPDF, LICRA, for the history or present illness, PAM hits FOS for the past medical history, and review of system then for CS pepsode. So this one we keep in the back of our brain. You can see I have a separate video on just this diagram. You can go and review it. But now we will talk about the differential diagnosis, the important questions for each differential. So it's very important to know 2 to 3 questions for each diagnosis based on the symptoms and your medical knowledge. So for chest pain, let's talk about chest pain. Chest pain, what are the differentials for chest pain? Number one, we have heart attack. Could be a heart attack. It could be pericarditis. It could be pneumonia. It could be pulmonary embolism. It could be pleuritis. It could be GERD, costochondritis, aortic dissection, and could be due to cocaine abuse. So for myocardial infarction, we have a couple of important questions that lead us to think that it's an MI. Shortness of breath is one of them. So do you have any shortness of breath? Okay. Sweating, another one because sympathetic activation. Racing of heart, another one. The pain improve after resting. I don't know why this picture is here, but that's the this is just random. And so this is another thing. Does the pain gets better when you rest? This indicate an angina. Okay. Pericarditis, two important questions that you should remember. Number one is that any flu. Did you have any flu? For example, any runny nose, any watery eye, sore throat, fatigue, because it happened after a flu, 2 weeks after a flu. And the second question, any relationship of the chest pain with breathing. Does it get worse when you breathe or when you lean forward? This is one of the characteristic of pericarditis, because when you lean forward or breathe, the heart will touch the pericardium more and you will have more pain. For pneumonia is that, have you been exposed to sick people? It's important. Any coughing. Coughing is important too. For pulmonary embolism, we need to ask 3 important questions. Number one, is any cough pain? That's an important one. Second one, have you been immobilized recently? Any history of lack of activity? Like for example, when you have a fracture or something that prevents you from moving, that's when you see the pulmonary embolism. And the third one is that, are you taking any oral contraceptive pills? Because this increases risk for pulmonary embolism. And the fifth differential is the pleuritis. Pleuritis, the only question about is a pain related to breathing, similar to the one in pericarditis. It's basically inflammation of the pleural membrane. For GERD, we ask any burning sensation in your chest. Okay, that's one question. The second one, any change in the taste of your mouth. They have that too. Burning because the acid comes to the esophagus and causes burning. Taste is the same reason because of that. Costochondritis, this in physical exam. When you do physical exam, palpation is pain when there's palpation. Okay, so to ask about it, you can tell them any pain when you press on it. Okay. For aortic dissection is usually when there's a history of hypertension. So have you been diagnosed with hypertension? How's your blood pressure? For cocaine abuse, obviously, have you ever used any recreational drugs? This is a good way to ask about it. So after these questions, okay, and the basic questions of pain and past medical history, family history, social history, surgical history, we do physical exam. We can do hint exam, and we do inspect, palpate, range of motion. We can do hum and sign if they suspect PE, pulses, check the pulses, and we do cardio and pulmonary exam, which is listening to the heart and lung sounds. What blood test to order? We do CBC, CMP, this is routine. EKG, cardiac enzyme, very important. Chest X-ray for pneumonia. EKG, cardiac enzyme for MI. D-dimer and Doppler ultrasounds for PE. If those high, then we can consider CT angio. This is more. Arteriography, venography, we can do that too. It's also for PE, DVT. So this is the chest pain. Okay. Now we talk about the other differentials of heart. The other complaint, maybe a patient present with palpitation, not a chest pain, but they tell you that my heart is racing. This is a palpitation. So we ask about different causes. For example, cardiac arrhythmia could cause that. So we ask, do you feel your heart when it's racing? Do you find it, is there any skipped beats? Do you find that your heart is racing at a time and then slow at another time? Any chest pain, sweating? Those are one of the questions that we ask when we suspect cardiac arrhythmia. It's better to find it in the EKG. So that's another one. But we can ask these questions too. So for caffeine, okay, caffeine's not Coca-Cola. This Google search just random. So bring pictures randomly. But for caffeine, you ask, do you take any caffeine? Maybe because Coca-Cola has caffeine. So are you taking a lot of caffeine? What type of drinks that you have? Okay, fever. Have you had any fever? Okay, regardless of the cause, can cause palpitation too. For anxiety and panic attack, this is important, could cause palpitation or heart racing. So you tell them, you notice any racing of the heart, any difficulty breathing, okay, any dizziness when you have these episodes. Okay, this is not for an anxiety dizziness with these episodes. But for anxiety panic attack, is that when they are in crowded places, you ask them, is there any situation that trigger these palpitations? Okay. So this one, dizziness, forget about it. It's not that one. For hypoglycemia, we ask three important questions. Number one is that, do you have any history of high blood sugar, or do you have diabetes? Any skipped meals? Because if they skip meals, they have hypoglycemia. When hypoglycemia, this trigger sympathetic response and cause you to have fast heart rate. The third one, any recent changes in your medications. Okay, that's another one. Third one. Another one, anemia. We ask about it. Any shortness of breath when you move in exertion. Okay, this causes fast heart rate because the heart tries to pump as fast as it can to support the oxygen need of the body. And the second question, if for women, any excessive bleeding, because that's a common cause of anemia in women. For hyperthyroidism, this is very important question. We gotta have it in our differentials. Do you have any fatigue, any weight loss? Okay, skin changes, tremor of the hands. Okay, so these are the questions that we ask. So we gotta ask smart questions because these questions are the ones that are gonna give us the answer. So for palpitation, what do we do? What physical exam? We do hint, and we inspect, palpate, range of motion, Hammond sign pulses, and we do cardiovascular and pulmonary exam, and that's it. Regarding investigations, we do CBC, okay, with differentials. We do EKG, cardiac enzyme, Holter monitoring, okay. We do TSH, T3, and T4, okay, and CMP. We do that too, okay. So in a summary, when you have a chief complaint, you gotta know the differentials and you gotta know questions about each differential based on your medical knowledge. So a quick recap for palpitation differentials: hyperthyroidism, anemia, hypoglycemia, anxiety, panic attack, fever, caffeine, cardiac arrhythmia. For chest pain, the differentials are heart attack, RMI, pericarditis, pneumonia, PE, pleuritis, GERD, costochondritis, aortic dissection, and cocaine abuse. Okay, thank you so much for listening, and I appreciate any feedback. If there is any room for improvement, I'm more than happy to do so.